It's my life living with HIV. Like, comment, and subscribe. All right, we getting ready to go into Tito's Pizza. Tito's Pizza. And here we go. All right, y'all. She tried not to be in the camera, but here we are. We're at Tito's Pizza. Hi. Hello. Look at their lunch special, 8-inch pizza for $5.99 with one topping. Yay! Okay. Got my bag. Tito's honey barbecue wings. I forgot to show you. I'm sorry.
Free hard out, head honcho, nigga, no Titto, nigga. If it ain't about the money, ain't no use it. Bitch, nigga, miss me with it. Turn it. I'm riding in the gator, my shoes on deception.
Hello. It's me. It's Lisa Faye. Yes, coming to you live from my living room. Anyway, it's time to take my meds. Have y'all took your meds already? I hope y'all have. I switched it up. Different hands, different fingers. So I had Cymbalta for depression and anxiety. Yep. And then I had what? Genvoya for HIV. Yes, I take Genvoya for HIV to help keep my viral loads down. Okay? U equals U. Undetectable equals what? Untransmittable. I can't give it to nobody. So I'm going to take it. I know y'all heard that. I got something to read to y'all too, okay? Coming from the Lord, okay? Yeah. All right, so Philippians 1:12-13. Nothing happens to believers without a divine purpose. You hear that, Brianna? Mm-hmm. Nothing happens to believers without a divine purpose. Paul said that everything that happened to him, even the bad things, happened so that the gospel might be proclaimed. We see no element of self-pity or anger against his captors, and certainly no anger against God for his difficulties. All we see is his submission. Remember, nothing happens to a believer or to anyone without a divine purpose. God is in control all the time. That's all I got. Right here. This is what I'm reading it from. Yeah. All right, just getting a little more education of the Bible. And what Paul said. He had no animosity against God or the captors who caught him. He wasn't mad at them. It was a purpose. And he kept on doing what he was supposed to do. And that's talk about and teach and preach the gospel. All right. Talk to you later. And what? U equals U. You're responsible for your own actions. See ya.
Oh, that's cool. It's very brutalist. And you can put it on a bookshelf, too. Mm-hmm. It's got buns. Look at those buns. Buns of steel. Get it? Jesse'd be so proud of me. That was a good one. That's a really nice shape. Oh my gosh, is that stone? That is stone. I see. Look at the giant Potosi just hanging out in the middle of all this stuff.
Third time back to the market. We just dropped off another load.
I've noticed so much of it. Doesn't that look like water, the way it reflects the light?
It does.
Very mermaidish. And there's the Potosi, and we're not going to ask how much it is. We're going to pretend it's $4,000 and we can't afford it, and that's why we're not bringing it home. people. You know, it happens. Well, it's 5:20. We're going for round 4.
Hello, everyone. It's me, Lisa Faye, and I come to you live from my bedroom, and I want to give you some information on the symptoms of HIV. Okay? This information is coming from AHF, that's AIDS Health Foundation. What are the symptoms of HIV and AIDS? It can be years before symptoms of HIV make you feel sick. So many people may not know that they have it. That's why routine HIV testing is so important. At first, you might feel achy, feverish, or like you have the flu. These symptoms are your body's first reaction to the HIV infection. Common early symptoms include chills, fatigue, fever, mouth sores, muscle aches, night sweats, rash, sore throat, swollen lymph nodes. During this time, there's a lot of the virus in your system. It's really easy to spread HIV to others. The symptoms only last for a few weeks and then usually don't have symptoms again for years. But HIV can be spread to other people, whether or not you have symptoms or feel sick. HIV and AIDS symptoms in women. These symptoms are the same in both men and women, but a few more symptoms may present in women. Common HIV symptoms in women include changes in menstrual cycle, heavier or lighter periods, or bad PMS, lower belly pain due to pelvic inflammation disease, pain during sex, vaginal yeast infections. While any one of these symptoms can be the first sign of HIV infection, they can also be signals of other health issues. If you are experiencing any of these symptoms, contact your healthcare provider and make sure to get an HIV test so that you can get the care you need. If you want any more information, come back on my channel and I'll give you some more. Or you can also look up ahf.org, AIDS Health Foundation. I also would like to talk to you about how does HIV affect women differently. Okay, I have this information from hiv.gov, that's G-O-V. It reads, HIV may cause some health problems that are unique to women, such as gynecological health issues, increased risk of cervical cancer, increased risk of heart disease, HIV medicine side effects and drug interactions, and aging-related issues. Pregnancy and birth control also require careful management with a healthcare provider. The good news is that women with HIV who take HIV medicine called antiretroviral therapy or ART exactly as prescribed and get and keep an undetectable viral load can live long and healthy lives and will not transmit HIV to their HIV negative partners through sex. Undetectable viral load is a level of HIV in your blood so low that a standard lab test can't detect it. Learn more about health and prevention, benefits of viral suppression, and having an undetectable viral load. The gynecological health issues in HIV. Gynecological problems are common among women with HIV. Some of these issues women may experience are problems related to sexually transmitted diseases, that's STDs. STD screening and treatment are important for all women. However, they are especially important for women with HIV because some STDs like genital herpes, pelvic inflammatory disease, that's PID, and chancroid, that's CHANCROID, can happen more often and be more severe and or harder to treat. Also, having HIV and other STDs may increase the risk of HIV transmission to sexual partners. Vaginal yeast infections. In women with HIV, vaginal yeast infection In women with HIV, vaginal yeast infections can occur more frequently and be harder to treat. Reoccurring vaginal yeast infection, those that happen at least 4 times a year, can happen more often in women with advanced HIV or AIDS. Bacterial vaginosis, BV. BV is a condition caused by changes in the amount of certain types of bacteria found in vagina. BV is more common in women with HIV and may be harder to treat. Menstrual cycle problems. Women with HIV may experience missed periods, lighter or heavier bleeding, or more severe premenstrual syndrome. Treatment is available for these health conditions. Talk to your healthcare team about treatment options that are right for you. Cervical cancer and HIV. Women with HIV have a higher risk of cervical cancer. It is important that they be screened regularly for this disease. Cervical cancer starts in the cervix, the lower, narrow part of the uterus, the womb. It is an age-defining cancer. That means that a diagnosis of cervical cancer marks the point at which a person's HIV infection has progressed to AIDS. Most cases of cervical cancer are caused by the human papillomavirus, HPV. There are many different types of HPV, with some types that cause cervical cancer and other types that do not. The types of HPV that cause cervical cancer are more common in women with HIV. Cervical cancer is largely preventable through regular Pap tests and HPV vaccinations. For this reason, women with HIV need to get regular Pap tests to screen for changing cervical cells before they turn into cancer. Talk to your healthcare provider about the Pap test schedule that is right for you. The HPV vaccine is recommended for women and men and HIV through age 26 if they have not already been vaccinated. Some adults ages 27 to 45 who have not already been vaccinated might choose to get the HPV vaccine after speaking with their doctor about their risk for new HPV infections and possible benefits of vaccination. Again, you can get this message from hiv.gov.